Hi, Tyler McKelvey. This is my cat health check video. I'm having to use a toy because the cats I was using last night, they were just not cooperating anymore. They were definitely done. So the first thing you need to do, this is going to be the cat I'm using. The first thing you need to do is make sure you have yourself prepared. So make sure you remove any jewelry and have your hair tied back. Ooh. And make sure you've got some gloves on. And I have my gloves right here. Boom. Cool. So while I'd be doing this, the cat would be running around, just looking about, and I'm looking from afar. So a healthy body condition score for a cat using the 1 to 5 chart is a 3. A 3 is a good weight. If you can see their tailbone or their ribs or their spine, that's an indication that they're underweight. And we all know what a chunky cat looks like. They're too fat. They could be breathing a lot faster because of weight problems, but this one looks good. So, yep, she's going to be a 3. Cool. I'm having to video this myself, and so sitting down was the easiest thing for me to do. I'm sorry. Cool. So once you've got the cat in a suitable position to give it a further examination, you've got good restraint of it, we're going to work in a system. So first I'm going to look at her eyes. They're fine, they're clear, obviously it's a toy. If there's any sign of redness or like gunk coming out of them, that is a sign of the feline herpes virus, FECV, I'm pretty sure. So obviously you need to get that looked at. While I'm doing this, I can also be feeling their breaths. So I can't really count the breaths, but you can work in 4 segments of 15 seconds. So count for 15 seconds and then times that by 4. So a cat's breath range is 20 to 30 breaths per minute. Yeah, while I've got my hands here, I couldn't possibly be able to feel the heart rate. Otherwise, you come down into the muscle down here. And the cat's heart rate range is 130 to 180 beats per minute. Cool. So while I'm doing this, I'm also just checking over for any lumps or bumps, anything that I can feel that's unusual. There's nothing. I'm now going to check the cat's capillary refill time and check her gums and everything like that. So I'd lift up her lip and I'd gently squeeze her gum, and her gum should come back in colour within 2 seconds. That's the healthy gums. I want to look for any blackness or discoloration on the gums, any rotten teeth or missing teeth, depending on the age of the cat, depends on their teeth. So a kitten might be missing some, but that's because their new ones are coming in, whereas an older cat might be missing some because they're starting to fall out or they have a gum disease. Sweet. I'd check the ears. There are no signs of mites or anything, or any dirt, redness or inflammation there. And I'd check the skin as well and the coat. So I would check down by the base of the tail, up on their neck, as well as by their ears. I also have to, I'm unable to check their temperature, but the correct temperature range for a cat is 38 to 38.5 degrees Celsius. I'm pretty sure. Oh, and their claws as well. So checking their feet, making sure their paws are all intact and they're not looking too red or anything like that. Sometimes their paws can get burnt on the sun, the concrete from the sun. I'd gently press on their paw pads to make their claws come out, and I'd have a look that they're not overgrown or they've got any missing, anything that just looks abnormal and like it could be causing pain. Sweet, thank you.